Good afternoon, everyone, and welcome to our live video this afternoon. We are coming from Freeport Medical Center. I am Dr. Das, and today we are speaking about a very important topic of anemia. In fact, I am extremely excited about this topic. It's a topic which I believe is very important, and quite a lot of patients usually present with this problem. So I would like to start off this afternoon by welcoming everyone to our regular weekly live video, and to apologize for not having a presentation last week. In fact, I was attending a conference, a medical conference last week, and hence I was not able to do this video. I'd also like to welcome all of our patients, our Facebook followers who look forward to our videos and who follow us on our Facebook page to this afternoon presentation, and as well to remind you all of our YouTube video, a YouTube channel, which you can log on YouTube or search Freeport Medical Center on YouTube, and you will be able to see all of our video presentations on our Facebook, our YouTube channel. Remember to like those videos and give us a thumbs up so that we can get some good ratings. In addition to that, I like to send early Happy Father's Day to all the fathers, particularly all our fathers all our patients who are fathers. We know that Father's Day is coming up this Sunday, and to tell you all to make sure and spend some time with your children on Father's Day, and have a great day over this weekend. All right. Today the topic is one on focusing on blood, and it's a very common condition affecting both males and females, and anemia is considered to be a condition in which your blood is losing its capacity or its ability to transmit oxygen. This function is done by the red blood cells. So if you're to define it more specifically, it will be considered to be a condition where your blood count, which is an index of your red blood cells, is lower than what it should be. In normal males, the blood count would be between 13 to 16 milligrams per deciliter, and in females it would be between 12 to 14 milligrams per deciliter. So if the blood count in men drops below 13, you will be considered to be anemic, and in female, if it drops below 12 milligrams per deciliter, you will be considered to be anemic. Now, if the blood count continues to drop, when it reaches a level of 10 in both men and women, it is considered a time when the doctor should intervene and should start treating and investigating what are the causes, or what could be the possible cause for this client or this patient to become anemic. Alright, so that's the first thing we need to understand, and to know that anemia is when your blood count, which is the hemoglobin in the red blood cells, has dropped below its capacity to transmit oxygen. And as I explained before in previous videos, that your body needs oxygen, glucose, which is your nutrients, to survive. You must get those two ingredients, oxygen and glucose, alright, to survive. Now, in terms of anemia, it is in fact, it is the most common nutrient deficiency worldwide. In fact, over 2 billion people suffers from anemia. Over 2 billion people suffers from anemia, and particularly iron deficiency anemia. Iron deficiency affects over 1 billion people worldwide. So it's as I said, it's probably one of the most common problems you can find in the medical literature. It's very common in the extremes of life, so you would find it commonly in children and in the elderly patient. particularly so because of their diets. So you find sometimes the elderly patients, their diet is not conducive to eating a lot of iron-rich foods, for example, and children sometimes they're not eating the appropriate foods that are rich in iron. So you will find it common in both extremes of life. It's also common in the pregnant patient, and hence the reason why a lot of doctors will prescribe iron vitamins for women when they are pregnant. All right, and it is mandatory now to do a blood analysis for your hemoglobin level in pregnancy. It is mandatory. If a doctor is seeing a pregnant patient, he must do a blood hemoglobin level to check to see what the blood count is, as I explained to you. If it's below 10, that is critical and you need to start doing some tests. All right. It is also common in people who are having like bleeding symptoms, like rectal bleeding, if they're passing blood, heavy bleeding, etc. All right. For example, women who have fibroids, or patients who has ulceration of the stomach where they will have bleeding. It's very common to develop anemia in those patients. All right. As I've explained before, iron deficiency is the most common form of anemia. All right. Now, what about the pathology of anemia? Well, to understand the pathology, I like to give a small amount of physiology about blood. Now, blood is considered to be an essential connective tissue which contains all the blood cells. For example, you will have red blood cells, white blood cells, and platelets. Those are the three main types of blood cells. And together with the blood cells, you will also have proteins and hormones and nutrients, etc. in blood. And the blood will then transmit all these nutrients throughout the body. So it's more or less a transporter. Blood transports all these nutrients throughout the body. Now, your body contains on an average about 6 liters of blood. Everybody generally has about 6 to 7 liters. It could be a little more, a little less, as the case may be. And red blood cells, which has a lifespan of between 3.5 to 4 months, resides in the blood. And red blood cells are made up of a protein known as a globulin and iron, which makes up the red blood cells. And this iron now is used to transfer oxygen, which it takes up from the lungs, throughout the body. All right. Now, if a patient becomes anemic, let's say the blood count drop, and I will discuss later on some of the causes of low blood count. But what happens is that the body will try to compensate, and to compensate for this drop in hemoglobin, the body goes through different changes. And one of the main change that the body would go through would be that the heart would try to compensate by beating faster and also stronger. So what you would find is that if a doctor examines a patient's pulse who is anemic, his pulse rate will be higher than what it normally would be. So it would be like in the 90s or even sometimes over 100. I've seen patients who were very anemic had a pulse rate of 120, for example. And if the anemia is due to a low volume as well, the pulse will be weak. So it will be a weak pulse but very rapid. All right. And if the patient does not get treatment, or if the anemia gets worse, then the heart continues to beat at this fast pace. Sometimes it can go into, it can develop problems, which can sometimes cause it to develop some kind of heart failure. So you have to be careful that if a patient is anemic and they do not get the recommended treatment, then it can eventually lead to the heart overworking, developing. It will eventually swell and as the heart swells, it will go into heart failure. So it is very important and critical that we understand anemia and try to treat it as quick as possible. Alright, now when you consider anemia or low blood count, it can come about as a result of, generally, I would like to say, three main categories of causes, or three main categories of problems can cause anemia. And as I explained to you about blood, the blood generally the blood cells are manufactured by the bone marrow. Now, if you are not producing enough red blood cells by the bone marrow, that could cause you to become anemic. Or if you are producing the cells, and when it gets into the blood, it's been destroyed too fast. Remember, I explained to you that the red blood cells lifespan is between 3.5 to 4 months. So if the red blood cells is not surviving its 4 months, then it can cause it to become, your blood count will drop and become anemic. And the third one is that if you are losing blood, so if you are losing blood via bleeding, for example. So those are the three main categories. We can go into a little bit more because I want to explain so that we can understand a little bit more about each category. Let's start off with the one with the manufacturing the blood. Now, blood in itself generally needs iron. So the first important ingredient or the component of blood of red blood cells would be iron. So if you have a low iron, whether it be from diet, as the case may be, you're not eating enough, or other causes for low iron, you will definitely not be able to produce the blood as fast as possible. Vitamin B12 deficiency can also cause it, and folic acid can also cause low blood. If a patient bone marrow become aplastic, and it is known as aplastic anemia, where the bone marrow becomes non-functional, so therefore the patient may be unable to produce all types of cells. So you may have a pancytopenia, where you have all the different cells that have dropped. The white blood cells will also drop, the red blood cells and the platelets. So if you have aplastic anemia, that will also cause it as well too. Other than that, you could also have from the manufacturing of the red blood cells a condition known as thalassemia. Thalassemia is when the protein chain that is used in the manufacture of red blood cells is missing from thalassemia, as well as bone cancer. So you can have bone cancer causing a slow manufacture of blood as well too. All right. You could also have, there's a hormone known as erythropoietin. All right. We've been having some internet issues where we are not getting proper connection. Apparently the video had dropped for a few minutes, so I'm just waiting to see and to ensure that the connection is up properly. Alright, I think it's back up. Alright, so I was also speaking about a condition in which a hormone known as erythropoietin, which is produced by the kidney, if it's not manufactured from kidney failure, for example, that could cause the speed at which red blood cells are produced to get lower, and hence the reason we see quite a lot of patients who has kidney failure to be anemic because their blood count drops due to the kidney failure. Now let's assume now that the body is producing the red blood cells, you have enough iron, you have enough protein, manufacturing the red blood cells gets out from the bone marrow into the blood. but now it is being destroyed as it goes out into the blood. It is being destroyed, and the most common, the normal shape, and as it gets out into the circulation, the cells are destroyed. So the blood count tends to drop. All right, iron enzyme deficiencies, for example, pyruvate kinase and glucose 6-phosphate deficiencies can also cause it. If you have antibodies produced against red blood cells, which is also inherited. All right, I'm back on again. I'm really sorry about that break in the video again. There is a poor internet reception today, so I have to apologize for these breaks in our presentation. Okay, I'd like to say hello to K. Aski. Is anemia hereditary? That's a very good question, and I'm now going to speak about some of the causes of anemia due to destruction of the red blood cells. And I just mentioned just before the video went out that you can have anemia from deficiencies of enzymes like glucose 6-phosphate dehydrogenase deficiency or pyruvate kinase. These are enzymes that become deficient if there is an inherited condition on their chromosomes. I believe chromosome 16 and chromosome 7, as the case may be. Right? Sickle cell disease is also an inherited disease. Thalassemia is also inherited. Yes. So yes, there are a few causes of anemia that can be inherited. Definitely. Right. As I said, there has been some intermittent internet connection today, so please bear with us as we try to complete this presentation. Apart from those, you also have the body producing antibodies, and these can be autoimmune antibodies which can destroy the red blood cells as they get out from the bone marrow into the blood circulation. So you can have antibodies produced to the red blood cells. You could also have the what we call Rh incompatibility. It's a little bit technical, but what it means is that the red blood cell antigens have stimulated antibodies that can destroy the red blood cells. This is different from autoimmune antibodies because you can have Rh antibodies produced, for example, during pregnancy, where a female produces Rh negative, where a mother who is Rh negative has a baby who is Rh positive, and there can be destruction of the baby's blood due to the mother antibodies. Alright, you also have, if you have blood transfusion and you transfuse the wrong or the inappropriate Rh antibody blood, yes, that can be destroyed and can cause the patient to become anemic. Alright, another category for destruction of blood will be mechanical destruction. For example, patients who have renal failure and who are having dialysis, that can destroy the blood. Patients who have had surgery, for example, patients who have had surgery can also have destruction of the blood. Infections, for example, like malaria, could also have destruction. All right. Yes. I'd like to say hello to Marika Edwards Maxwell. I see that she has a question. Can you do a live on natural ways to treat hormonal acne or polycystic ovaries? Acne. That is definitely one of the topics that we'll be discussing. So, Marika, we'll keep you in touch. You just keep checking our Facebook page. We will be discussing acne. It's a very common condition as well. We already have a topic for next week, so it will probably have to be later down. Alright, but for now, I would like to say that it is a condition that I will discuss. And polycystic ovaries, that was already discussed. So if you check our YouTube channel, you will be able to see the video on polycystic ovaries. Hello to Cindy, Ramnarayan. Hi Doc, hope you have a nice day. Thank you very much. Okay, very good. Alright, appreciate it. Okay, Marika, no problem. Alright. Yes. Okay, very good. Alright, the other category for under the pathology of anemia would be blood loss. Now, this is actually one of the most common causes of anemia, particularly so because we have a lot of medical condition that causes patient to lose blood. For example, if a patient has a tumor or a cancer in their colon cancer, you can have blood loss from that. You could also have blood loss from stomach cancer. You could also have blood loss from ulceration of your stomach. So all of these conditions in your intestines, which is losing blood, and sometimes the patient is unaware that they are losing blood. So as you lose the blood, you lose the red blood cells and your blood count tends to drop. In addition to that, we can also have blood loss from fibroids in female patients who has fibroids and has heavy periods, menorrhagia, and they can have blood loss from this as well too. You can also have blood loss from trauma. Like if a patient has a laceration and they are bleeding heavily, you become anemia in a very acute phase, and that can be very fatal and sometimes very, very serious. Alright, a very important cause of anemia in children would be infection by parasites and worms. So sometimes I've seen children who come in who looks very, very pale, and when we do a stool analysis, we realize that there are worms, hookworms, nematodes in their intestine, causing them to lose blood and to become anemic. So parents have to look out for this in children, especially children who play out in the yard and in the fields where they can pick up infection in their hands, and as soon as it gets into their mouth, they can get infection with worms. All right. So therefore, what are some of the symptoms for anemia? I see Devon. Hello, Devon. Devon is an avid follower of our Facebook page. He has a question. Hello, doc. My iron levels are low. What type of food should I eat to build up the levels? Very, very good question. Patients who has a low iron and is causing anemia, I have to tell you some good news that we live in a tropical country where there are lots of food rich in iron, and you need to utilize those. For example, the most common one is bhaji, and everybody knows about bhaji, dashi in bush particularly. It's very, very high in iron. You also have beetroot, which is very high in iron. You also have green fig. You also have broccoli, lettuce, cauliflower. All of those foods are very high in iron. Green fig is also very high. I remember quite a lot of times recommending these to patients. All right. I see another comment here by Surai. Hello, Surai. Surai is also one of our friends from Facebook. She said that she appreciates the video very much. Thank you very much for your kind comments, Surai. Alright, so symptoms. Now, if a patient is anemic, if we think of the pathology that I explained, your body needs oxygen. Oxygen is transmitted by the red blood cells, and now you have less red blood cells. What happens? Then your body will be lacking oxygen, and if you lack oxygen, then some of the symptoms you would obviously experience would be short of breath, because you don't have oxygen in your body. So therefore your body will start becoming short of breath. You will start feeling tired. you will start feeling drained, like your body doesn't have the energy. So you're having lack of energy, feeling drained, tiredness. You will also have problems concentrating because your brain is not getting enough oxygen, so you cannot concentrate. All right. Patients will have signs of heart, like they'll feel palpitations. They'll feel sometimes difficulty lying, sometimes to sleep properly. You may have a dry cough. So those are some of the symptoms that you don't see so often, or if you have those symptoms, you're not aware of the cause of it. All right. Patients will, if it's coming from a secondary cause, like in kidney, you may have swelling of your feet, shortness of breath. You may have difficulty moving about. All right. And some of the more common symptoms would be pallor. So that if you watch a patient who is anemic, you will see that their eyes look very pale and sometimes glassy. You will also see that their skin looks very pale. And if you watch closely at their nails, that's one of the most common places that doctors will examine. You will see that the nails are pale, it looks brittle sometimes, and it has a particular shape to it, which shows that there's anemia taking place. All right. Then as you go up the patients. If a patient has endocrine problems, for example thyroid, you will see the thyroid symptoms on their face. Alright, yes. I'm seeing here, yes, as K is also asking, what is folic acid? Very good question. Folic acid is a vitamin, and it is essential for the production of red blood cells. So therefore, if you don't have folic acid in your blood, your red blood cells will show up in a particular way. And as I go to doing the blood test, I'll explain to you a little bit more of how the blood looks with a lack of folic acid. Hello Surai again. I see Cindy's asking, what's that one? For my acid reflux in stomach, or do I have to stick with drinking milk? That's Cindy, you put me in a controversial position there, but yes, as I explained to you, there has been periodic breaks in our internet connection, so we are not getting quite a good connection. But for acid reflux, because it's related to acid, you would want to drink and eat foods that are alkaline, and milk is one of the most alkaline products that you can drink. Hence the reason we prefer to recommend milk and milk products. But pawpaw is also good. It is probably not as good as milk, but it can be used as well too. Alright. Shanti Sumir is saying, tell me about triple bypass surgery. Right, triple bypass surgery is one form of treating patients who have blockage of the arteries of their heart. We are not discussing that today, but just to let you know that it is done in patients who have heart disease and who are at risk of developing a heart attack. So therefore, you have to see a doctor, make the proper diagnosis. There's a test called an angiogram which needs to be done, and then you would know if you need to have a bypass, whether it be single, double, or triple bypass. All right. So in terms of symptoms, we have to look out for kidney problems as well, thyroid problems, and as I said, pallor, tiredness, short breath, all the other symptoms that I've mentioned before. Now, if a patient comes to me who appears to be anemic, I will yes, definitely you will have to run some blood tests. And the first test that has to be done in patients who are anemic would be a complete blood analysis. A complete blood analysis consists of looking at the patient's red blood cells, your white blood cells, what we refer to as the mean MCV and the MCH. the MCV is the mean corpuscular volume, right? So, and you need to check the volume of, it gives us a reflection as to the volume of iron in the red blood cells. If the patient is anemic, obviously you look at the hemoglobin level, which will be low, but then we want to see a little bit more as to whether the patient has deficiency of iron or deficiency of B12 or folic acid. B12 and folic acid causes a particular type of appearance on the blood cells, and what we refer to as macrocytic, which the blood cells look megaloblastic or larger than what it normally looks. As opposed to a patient who has iron deficiency, the blood cell looks smaller. So right away a doctor can diagnose whether a patient has folic acid deficiency or B12 deficiency as opposed to iron deficiency by looking at the blood analysis. Okay, if a patient is anemic, we would also want to do the elements of the blood, that you will want to check the iron levels, the folic acid levels, the B12 levels, the ferritin levels, the protein binding globulin levels in the blood. Those are things that we look for in the blood. Alright, in addition to that, we also check all the different hormones like your thyroid hormone. You also want to check the kidney function test. You want to check the liver test as well too. Sometimes if a patient has autoimmune disease, we will also want to check their blood group and RH level. RH. We'll also like to check their rheumatoid factor and the lupus levels. We must check the patient for thalassemia and sickle cell disease by doing a hemoglobin electrophoresis. That's a special test as well too that I recommend to some of my patients. Hemoglobin electrophoresis. Alright. We also check the, as mentioned before, kidney function test must be done to check for kidney failure. Alright. Yes. Sometimes if the anemia is very bad, we also have to particularly in middle-aged people, we also have to check their stool for blood, because sometimes if you have a bleeding and it's not showing up obvious, you will have to check the stool for blood. In the elderly patient, you have to do a colonoscopy and an endoscopy to check for ulceration of your stomach and for colon cancers and colon lesion that can be bleeding in the elderly patient. Sometimes if we suspect bone cancer, you have to do a bone marrow biopsy. A bone marrow biopsy is not something that we will choose as the first test. You will do your blood test first. But a bone marrow biopsy is so important, especially in children who can develop sometimes leukemias, for example, and that can affect the bone marrow and affect your blood cells. It will also affect your white blood cells as well. Right? In females, you have to do an ultrasound of their womb and the pelvis to check for fibroids, and the ovaries to check for polycystic that can cause irregular bleeding. In pregnancy, you must check the patient with an ultrasound and blood test as well. So when you go to the doctor with this problem, there are different categories of patients that will have to do different tests. Okay? Once the patient has been diagnosed with anemia, you will have to get to the root cause. What is causing the anemia? So the patient has a low blood count, the patient has kidney failure, or the patient is having enzyme deficiency, like in children you check for glucose 6-phosphate deficiency, for example. You have to treat the problem. All right. So each problem are treated specifically. So if a patient has kidney failure, you treat the kidney failure. If the patient has iron deficiency anemia, that's a different type of treatment. Generally speaking, we will try to get to the cause of it. If the patient has an ulcer stomach, we have to fix that problem. Colon problem, we have to fix that problem. If a child has sickle cell disease, we have to advise the parents how to go ahead treating it. But in terms of iron deficiency anemia, the patient is put on a diet that is rich in iron, and I explained to you already some of the things that we want to use that are high in iron. But the patient must also be given iron supplements. Generally speaking, iron supplements can be taken as tablets, and these tablets should consist of at least a minimum of 120 grams of iron per day. That would be elemental iron. So you have to be careful. You have to check the contents of the tablets. Sometimes a tablet may have 300 milligrams of iron, but it doesn't have 120 milligrams of elemental iron. So elemental iron is what you need to check for. All right, and these tablets are taken. These tablets are taken on a daily basis, and it is said that if you're giving the patient iron, their hemoglobin level should go up at a minimum of 1 milligram per deciliter per month. So let's say the patient blood count is 8. In a month time, when you recheck the blood count, the hemoglobin should go up to 9. If it is not going up, then there is something more that needs to be treated. In addition to iron tablets, you can also give injections, and we have parenteral iron injections which can be administered to increase the iron levels much more rapidly, and patients can get those injections very fast. You also have patients who, for example, is on kidney failure and not producing the erythropoietin. We can give erythropoietin injections as well on a weekly basis, as the case may be. So depending on the cause of the anemia, you treat appropriately. But it's important to understand that patients may need iron tablets, iron injection. If the blood count drops below 6, sometimes even a little bit higher, like 7 or so, if it drops below those levels, patient may need to get blood transfusion. And blood transfusion sometimes could be a life-saving measure. So it's important to know that patients may need to get blood transfusion if the blood count drops critical levels. As well as, that brings me to the point of remembering that in terms of the blood transfusion, we are up to blood transfusion day, which is Wednesday the 14th, and I would like to advise everyone it is very healthy to give blood, healthy to donate blood, and I know that our blood bank is in dire need and dire short of blood, so we can all go out to our blood bank. It's located at Port of Spain General Hospital and the Eric William Medical Science Complex, where patients can donate blood. It's always a good gesture to give blood. You will have to do some tests, and once your blood is healthy, they would be able to accept your blood transfusion. All right, so I think that's in a nutshell what we would like to talk about in anemia. I've spoken about the treatment. I'm seeing another question here. Spartan, Angel, and others, just spare your video. Let them know. Yes. Let them know that we appreciate it. So thank you very much, Spartan. I think that I've spoken a lot about anemia. It's quite a very exciting topic. I'd just like to say that the prognosis for anemia depends on what is causing it. So as a doctor, you have to get to the bottom cause of the problem, and then a diagnosis can be made and be treated appropriately. Right? In terms of this topic, I like to wrap up there now and to tell you all that. Yes, we have another question.
Why are anemic patients more susceptible to getting strokes?
I didn't see that one. Yeah. Okay. Oh, Ravi. Hello, doctor. Anemic patient most of right. In terms of strokes, the patients who are anemic would tend to cause hemodynamic, I'm going a little bit more medical here, hemodynamical change in their body, in which their heart will be pumping much more forcefully and much more stronger. So the pressure in the system, in their blood circulation, is going to increase, and as the pressure increases, it can cause a tear in your blood vessels in your brain, and if this happens, of course, a patient can develop a stroke. So there are so many complications in terms of the pathophysiology of stroke and of anemia, but definitely you are much more susceptible to developing stroke. Yes. All right. With regards to our topic next week, I would like to tell everyone that we will be discussing thyroid disease. Thyroid disease is also a very common condition. It's a condition which a patient could be producing more hormones or less hormones. I'll try to cover it in our video. I try to keep the videos within 30 minutes, but today it has been a challenge with the internet, as well as it's a very long and interesting topic, so I had to go a little bit over today. So I'd like to thank everyone for looking on. I really appreciate all our friends, all our followers who have been following us since the beginning of this year, February, when we celebrated our 10th anniversary. I know we have quite a lot of followers who follow us. We are seeing some questions coming from some followers from Pakistan. I'd like to say hello to them. I didn't see them on today. We have friends from Toronto, from New York, everywhere. They're looking on and following our videos. So please look at the video, share it with your friends, let your friends know about our YouTube channel, and I will see you all again next week. Bye. Until next week, we'll be discussing thyroid disease. And happy Father's Day again to all our fathers, all our patients who are fathers. Thank you very much, and bye.